From Willis Towers Watson, welcome to Ion 65, a podcast for public sector employers concerned about retiree healthcare.
Hey, Nina, it's great to be back with you again on this beautiful fall day in Columbus, Ohio. What's the weather like in South Carolina?
It is a warm, beautiful, sunny day, and I cannot complain, so I won't.
Okay, great. Well, today we're going to talk about kind of a heavy subject. You know, a lot of people have the misconception that drug costs for a retiree in an individual drug plan can be more expensive than in the group marketplace. And I hope we, by the end of this podcast, help our listeners understand that that's really not true. From what I'm seeing, the drug costs in the group Medicare marketplace are going to be typically more expensive.
Yeah, this is a really interesting topic to me. In our last episode, we talked about the differences between group Medicare plans and individual Medicare plans, and we ended it with a question that I had about how Part D individual drug plans work. So I'd love to tackle some questions about individual Part D drug plans in today's episode, if that's all right with you.
Yeah, I think that's great. It can seem complicated for some folks, so let's break it down step by step.
Yeah, so my understanding is that drug coverage is not something that has always existed in Medicare. Is that right?
That's true. So drug coverage didn't come about until 2006, and it wasn't great coverage at first, Nina. It had a big old donut hole, and, you know, it just had a lot of cost exposure for retirees. But it has gotten so much better over the years. And today, there are an estimated 47 million Americans in Part D drug plans. And there are nearly 1,000 standalone individual drug plans across the country. You know, the typical retiree has a choice between 20 and 30 separate drug plans to choose from in the individual Medicare marketplace. And this compares generally to only one drug plan option, maybe two, in a group Medicare model.
Yeah, and you've talked about this before, that most of these group Medicare plans have copays for different tiers of drugs, from generic to non-preferred brand to specialty drugs, and the specialty drug can be rather significant. Plus, retirees might not find that one of their specific drugs is covered on their formulary. And in a group setting, if that formulary changes, the retiree doesn't get the option to pick another one.
And, Nina, let's keep in mind that in a group model, the employer provides a subsidy towards the premium of the total medical and drug plan. And that subsidy can only be used for a premium, not for any out-of-pocket drug costs, which can happen in the individual Medicare marketplace model.
This contrasts with the individual Medicare marketplace model, where the employer subsidy can be used for the plan premium, the Part B premium, and the out-of-pocket medical or drug costs. Can you describe how individual Part D plans are different from typical group Part D plans?
Sure. So typically, an individual using a Medicare marketplace or exchange, retirees get to choose their individual drug plans, and they usually have a choice of about 30 different plans. So think about it. That's 30 different formularies that they get to pick from.
Oh, wow, that's a lot of choice. So that means that pretty much anyone can find a drug plan that is best for them. I might even go out on a limb here and describe it as being tailored to their needs.
You know, that's exactly true. And these Medicare exchanges have very sophisticated software that once they put in information, or the retiree can do it on a website, about their drug utilization, the best plan, the cheapest plan, the most affordable plan pops up, and it makes it really easy to come up with which of those 30 plans is best for them. And the other thing about this is that retirees can change their drug plan every year, and it's always guaranteed issue.
Meaning there's no need to go through medical underwriting.
That's correct.
So how exactly are these individual Part D plans structured?
Well, these plans have phases. First, there's a deductible phase. Next, there's an initial coverage phase where there are copays. And then there is a donut hole phase, which could have slightly higher drug copays. And finally, there's a catastrophic phase, which could have significant costs to the retirees. In a moment, we will talk about how we can completely eliminate retiree costs in the catastrophic phase.
So there are different phases, I get that. But do all retirees reach each phase?
No, they don't. I'm glad you asked that. But first, I want to point out something about the deductible phase. Most plans nowadays do have a deductible phase. But in general, 90% of prescription drugs in America can be filled with a generic drug. And the good news is that generic drugs do not have the deductible applied to them. So for most people, the deductible phase does not, dare I say, Nina, phase them. And oftentimes, these individual Medicare drug plans have a $0 or very small copay for generic drugs.
Well, that's good news. What about the other phases?
Okay, so the next phase is called the initial coverage phase, and really 82% of retirees never leave this stage. And for these retirees, they will find their out-of-pocket drug costs in the individual Medicare marketplace model are much less than in the group plan. This is where they have generally copays, and they may have no copays for generic drugs. The next phase is the donut hole phase, where retirees may experience a slightly higher copay for their drugs. But again, Nina, only 18% of retirees will hit this phase, and in the individual Medicare marketplace model, they could submit claims for reimbursement of their out-of-pocket drug costs from their employer subsidy.
And the final phase is the catastrophic phase. Dun, dun, dun. That sounds pretty ominous.
Well, it does, Nina, and if you don't have the right coverage, it can be. So, only 3% of retirees reach this phase. They have very expensive life-saving drugs that could range from $1 to many thousands of dollars a dose.
And in a little bit, you're going to talk about a program that Via Benefits offers that can eliminate all of the retirees' costs in the catastrophic phase, which you said only about 3% of retirees ever hit.
That's right, Nina. These are people who have very severe illnesses and very expensive drugs. And again, it's a small portion of your retirees, but there is a way to eliminate all of their costs in that phase. Nina, I also want to mention that under the individual Medicare marketplace model, the premium we see for individual Part D drug plans averages about $41 a month across the country. Now, this compares to the average monthly cost of a drug plan in a group setting of about $250 or more dollars a month. At least that's what my research has shown me.
And from doing my own research, I understand that if you're in an individual Medicare marketplace or exchange model, you can pick either a Medicare Advantage plan, which already has a drug plan bundled with it, or if you pick a Medigap plan, then you also have to pick a standalone drug plan. Either way, it sounds like it's pretty comprehensive coverage, right?
That's true. You can get very comprehensive coverage in either model.
So you said there's a way to eliminate costs to retirees in the catastrophic phase. Will you please elaborate on that?
Sure. So what we do at Via Benefits is we add an additional health reimbursement arrangement. Now, it's a notional account, typically funded by the employer with an average of $50 per retiree per year. That's per year. And that funding amount is so small because so few retirees hit this phase. But when the retiree has a claim in the catastrophic phase, the retiree is reimbursed for their full cost by submitting a claim to Via Benefits for reimbursement.
So let me get this right. It's a very low cost benefit to fund, and it's funded notionally, meaning that the employer has to come up with the funding only once a claim is filed. And it covers 100% of the retiree's drug exposure in the catastrophic phase. That can be pretty significant for a very small percentage of retirees.
Yeah, that's right, Nina. It's a really important benefit for retirees who have these very expensive and often life-saving drugs. And for a plan sponsor who is concerned about coverage in the drug portion of their healthcare, this really does ease their mind knowing that they could really help those at greatest need.
Wow, that really is a great benefit and provides so much peace of mind. You know, I have a real life experience where my dad had tremendously expensive oncology drug treatments, and a benefit like this would have been incredibly helpful. So how would the catastrophic phase be handled in the group Medicare model?
Yeah, well, it's generally not as rich. In the group Medicare model, we typically see specialty drugs are covered with a coinsurance model, meaning the retiree could pay up to 20 or 30% of that drug. Sometimes there's a cap on it, sometimes there isn't. That means the total drug cost for these retirees who need these life-saving drugs can be really, really expensive.
That is just tragic, but because if you can't afford these drugs, you may have to forego them entirely.
Well, that's exactly right, Nina. And if the retiree isn't getting the drugs, their medical costs are likely to go up higher. And what is that going to do for your fund? It's going to drive your costs and your trend even higher. So you want people taking the drugs that can keep them out of the hospital.
This has been such useful information, Marianne. Thank you. I really appreciate it. I wasn't familiar with catastrophic drug coverage, but it makes a whole lot of sense. It really does seem that the individual Medicare marketplace model can provide real savings for both the retiree and plan sponsor.
Yeah, that's right. And with my mission to save retiree healthcare, I want to provide plan sponsors with a model that saves them money so they can continue to provide this valuable benefit to their retirees.
That's our program for today. Thank you so much for listening, and please tune in next time to Ion 65.
Thank you for listening to Ion 65 by Willis Towers Watson, a leading global advisory, broking, and solutions company serving thousands of employers worldwide. For more information on Willis Towers Watson solutions to manage employee risk, optimize benefits, cultivate talent, and expand the power of capital, visit us at willistowerswatson.com. You can find more episodes of Ion 65 on iTunes. Share with your colleagues with hashtag Ion65. That's EYEON 65. Join us next time